A stroke occurs when the blood supply to part of the brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. When it comes to stroke awareness, knowing the early warning signs can literally be a lifesaver. Imagine your body suddenly sending out signals, like a car dashboard flashing lights at the first hint of trouble. These signals are your body's way of telling you that something's not quite right in the brain department. It's like your body's trying to whisper, or sometimes shout, that it needs help ASAP. Which is why understanding the early warning signs of a stroke and acting quickly isn't just smart, it's crucial. So keep watching if you want to learn exactly what they are. Number 1. Sudden numbness or weakness. This symptom often manifests as an abrupt loss of strength or sensation, typically on one side of the body. It can affect the face, arm, or leg, making one side of the body feel inexplicably weak or entirely devoid of feeling. This sudden change can be a startling indicator that the brain is experiencing a critical interruption in blood flow, specifically to areas that govern sensory and motor functions. Individuals might notice a distinct difference when trying to smile or raise both arms, where one side responds differently than the other. Number 2. Confusion or difficulty understanding. This sign involves a sudden, unexplained difficulty in processing thoughts or understanding spoken or written language. Individuals may find themselves unable to grasp what others are saying, struggling to follow along with conversations, or feeling bewildered by tasks that were previously straightforward. This confusion can extend to disorientation regarding time, place, or identity, manifesting rapidly and without any clear cause. It's as if the brain's ability to decode and interpret information momentarily malfunctions, signaling a possible disruption in the brain regions responsible for cognition and comprehension. Number 3. Trouble seeing in one or both eyes. Individuals experiencing this symptom may suddenly find their vision blurred, dimmed, or completely obscured in one or both eyes. This change can occur abruptly, leading to difficulties in perceiving details, reading, or navigating environments. The loss of vision might be partial or total, presenting as a dark curtain that blocks out part of the visual field. This symptom suggests that the stroke is affecting parts of the brain responsible for vision, indicating a serious disruption in the pathways that process visual information. Number 4. Difficulty walking. This symptom encompasses a sudden trouble with walking, which may include dizziness, loss of balance, or an unexplained coordination problem. Individuals might find themselves staggering, unable to walk, or feeling as though the room is spinning. This can make it challenging to stand up from a seated position or to perform routine movements. The inability to control one's movements properly can be a sign of a stroke affecting the parts of the brain that coordinate motor control and balance, indicating a significant disruption in neural pathways. Number 5. Severe headache. A sudden, severe headache, often described as the worst headache ever experienced, can be a warning sign of a stroke. This type of headache may come on without any apparent reason and can be accompanied by other stroke symptoms. It might be particularly alarming if the headache is far more intense than any usual headaches or migraines the individual has experienced. The severe headache could indicate a hemorrhagic stroke, where bleeding inside the brain creates pressure that leads to intense sensations. Number 6. Face asymmetry. Face asymmetry as a stroke symptom is identified through a noticeable droop or weakness on one side of the face. When asked to smile, the individual's smile may be uneven or lopsided, with one side of the mouth remaining lower than the other. This sign is a direct result of the brain's inability to send proper signals to the facial muscles, reflecting damage to the nerves or brain areas controlling these functions. Face asymmetry can be a clear indication of a stroke, demonstrating how parts of the brain responsible for muscle control are affected. Number 7. Arm drift. Arm drift occurs when an individual attempts to raise both arms simultaneously, and one arm begins to fall or drift downwards, unable to maintain its position. This sign is often tested by healthcare professionals as a quick check for stroke symptoms. The inability to keep one arm lifted can indicate weakness or lack of coordination in that limb, suggesting a disruption in the brain areas responsible for controlling muscle movements. The arm drift test helps in identifying unilateral body weakness, a common characteristic of stroke affecting one side of the brain and, consequently, the opposite side of the body. Number 8. Altered vision. Altered vision encompasses a range of visual disturbances that can occur suddenly in individuals experiencing a stroke. This symptom may include double vision, loss of peripheral vision, or sudden blindness in one eye. Unlike the more generalized trouble seeing in one or both eyes, altered vision refers specifically to changes in the normal field of vision or the way objects are perceived. These changes can significantly impair an individual's ability to interpret visual information, navigate their environment, or perform tasks that require visual accuracy. It indicates that the stroke is affecting the brain areas involved in processing visual inputs, leading to these perceptual discrepancies. Number 9. Loss of coordination. Loss of coordination is a stroke symptom characterized by sudden clumsiness or an inability to accurately control movements. This can manifest as trouble walking, difficulty grasping objects, or an overall lack of precision and motor skills that were previously automatic. Individuals might find themselves dropping things more frequently, stumbling, or unable to perform simple tasks that require coordination between hands and eyes. This symptom suggests that the stroke is affecting the cerebellum, or other parts of the brain that are crucial for coordinating movement and maintaining balance, leading to these noticeable difficulties in coordination. Number 10. Speech impairment. Speech impairment during a stroke can manifest as slurred speech, difficulty in choosing the right words, or an inability to understand speech. This condition, known as aphasia, affects an individual's ability to communicate effectively. Someone experiencing a stroke might find it hard to express themselves verbally, with their speech becoming garbled or nonsensical. They may also struggle to comprehend what others are saying, making conversations confusing and frustrating. Speech impairment as a stroke symptom indicates that the areas of the brain responsible for language processing are being disrupted, affecting the person's linguistic abilities. A helpful shortcut to easily learn these early warning signs is to remember Be FAST, which is an acronym used to identify the most common signs of a stroke and emphasize the importance of quick action in such emergencies. B stands for balance, highlighting sudden loss of balance or coordination. E represents eyes, pointing out changes such as loss of vision in one or both eyes. F stands for face drooping, where one side of the face may droop or numb, and the person may have trouble smiling. A signifies arm weakness, where one arm may be weak or numb, and if the person tries to lift both arms, one arm may drift downward. S is for speech difficulty, indicating slurred speech or difficulty in understanding speech, suggesting the person might be unable to speak coherently or understand others. Finally, T stands for time to call emergency services, emphasizing the urgency of seeking immediate medical attention if any of these symptoms are observed. This acronym serves as a crucial reminder that stroke is a medical emergency requiring prompt action to minimize brain damage and potential long-term disability. From sudden weakness or numbness to difficulty speaking or understanding speech, recognizing these symptoms and seeking medical attention without delay can save lives and mitigate the devastating effects of a stroke. By raising awareness and educating ourselves and others about these warning signs, we can play a vital role in preventing unnecessary loss of life and disability due to stroke. If you want to support the channel, please like and subscribe. I would greatly appreciate it. There should be some other helpful videos popping up on your screen right about now that I think you will enjoy. And just a quick reminder, we are not doctors. This video is for informational purposes only. Thank you so much for watching. Have a blessed day, and as always, breathe easy, my friend.